this section, we will talk about what causes elder abuse and how to identify risk factors for situations where abuse is more likely to happen. Why do caregivers become abusers? It's too simple and simplistic and not helpful to say, well, they're bad people or they just don't appreciate their elders. No, when people are abusers, there are reasons for it. There are problems with them in their life, in their situation that make this more likely to happen. So the two biggest risk factors are mental health problems and substance abuse. If the caregiver is abusing substances, then they don't have good control over their emotions and behaviors. They become consumed by their substance abuse. And it's not surprising that if they're also a caregiver, they will abuse the person they're caring for. And hand in hand with substance abuse are mental health problems, depression, anxiety, more serious mental illness. A person who is dealing with poor mental health is not able to handle the stressors of caregiving, and they are much more likely to become abusers. That isn't to say that all people who are mentally ill are dangerous, but when people are mentally ill and are in an incredibly stressful situation where a person depends upon them, that's a recipe for a bad outcome. Financial problems, right? It's very, very tempting to take money from a vulnerable person if you really need that money, if you have financial problems. A person with anger management problems is going to lash out at someone they're caring for. A person who's experiencing a great deal of caregiver burden, a person who's not handling their caregiving well, much more likely to become an abuser, to lash out. If there's history of abuse in the person's life, if they were abused growing up, if they were abused by the person they're now caring for, if they themselves have been an abuser of a partner, of children, a history of abuse tends to breed more abuse. And sometimes caregivers lash out because they misinterpret the elder's behaviors, right? So if a person has dementia, they can become combative. And if the person doesn't understand dementia well, doesn't understand why this person is arguing with me, is insulting me, is saying bad things, is refusing to do what I need them to do, it can lead to lashing out. It can lead to abuse. Okay, so we talked, that's why family members or friends become abusers. Why do paid caregivers become abusive? Well, some of the same issues: mental health problems, substance abuse, anger management, misinterpreting the elder's behaviors. And then there are three more that are unique to the paid caregiver. Inadequate staffing, right? If a nursing home puts too much burden on each of its staff to care for too many patients without help. Very, very low pay where the person feels like, wow, I'm doing this hard job and I'm getting no compensation for it. And a lack of training, a lack of understanding, not having the skills to care well tends to make a person feel overwhelmed. And once a person feels overwhelmed, abuse can result. So who's most at risk? What elder is most vulnerable, or what caregiving situations are most vulnerable to abuse? So if the person being taken care of has dementia or other mental impairments, right? They're not aware of their surroundings, but often not aware of their actions, the consequences of their actions. They engage in problem behaviors. They might say things that insult the caregiver. That can bring on abuse or an abusive response, especially when the caregiver doesn't understand or is not well equipped to handle problem behaviors. If the elder is very isolated and has very few contacts aside from the caregiver, right? There's not anyone else looking in to oversee the situation, and maybe not anyone else to help. If the elder is very dependent on the caregiver, right? So the elder may be afraid to complain about the abuse to anyone because they'll think, well, at least I'm not homeless. If the person is homebound, again, stuck in the house with this one caregiver, makes them more vulnerable to abuse. As I said before, any past history in the relationship of abuse. And if the caregiver is financially dependent on the elder, right? So if you have maybe an adult child who has financial problems and they're taking care of an elder who has more money than them, and that elder is confused or dependent on them, the temptation to steal is great. So the role of ageism, sexism, racism in abuse. Ageism is discrimination against individuals or groups on the basis of their age. So having prejudices against or false beliefs about older adults, thinking that they're less than, thinking that they're past their prime, that they shouldn't live this long, that they're set in their ways, that they're difficult. Again, these prejudices might lead to abusive behavior. Discrimination against older adults, right? So if you're a staff member and you don't really like older people, you think that we don't have to give them as much respect, again, it could lead to abuse. And there are institutionalized practices that perpetuate age stereotypes, just like there are institutionalized practices that perpetuate prejudice and discrimination against people of color, against women, these institutionalized practices which perpetuate age stereotypes, which suggest that older people are weaker, older people are not as good company, not people you want to be with, they're difficult, etc. Any of that will lead to abuse, or at least it will open the door to feeling like this is a person who's not as good as me, and that makes you feel more able to abuse them. On top of age discrimination, older adults are overwhelmingly female. Men do not live as long as women, and so the older the group, the more female is the group. And again, if you have sexist beliefs, that's another reason to dismiss the person in front of you. She's old and she's a woman. And older people of color face added discrimination, right? Not only because of racism that's institutionalized, but also because that lifelong racism led to elders who are people of color having fewer financial resources on average, and sometimes living in communities with less access to quality medical care and community services, again, leaves them more vulnerable to abuse. So who is at risk of becoming an abuser? So the caregiver is mentally ill, emotionally unstable. The caregiver is facing multiple severe stressors. Not only are they a caregiver, but maybe they have job stresses, they have other family stresses, they have financial stresses. Multiple stresses compound each other, the person is more likely to snap. We've said substance abuse, financial dependence, history of abusive relationships, inadequate training, a lack of understanding of the elder's condition, inadequate resources, feeling overwhelmed, and of course, sometimes the elder is verbally abusive or hostile, and that can set a person off, especially if they have some of these other issues. If they don't understand the reason behind the elder being abusive and hostile, they don't understand what dementia is, they've had inadequate training, they feel overwhelmed, that can lead to abuse even when people are ordinary people without a history of abuse. So what can we do to prevent this? Well, providing home care services can reduce pressure on the caregiver, right? One person should not be solely responsible for providing care to the elderly. So if you see a caregiver is overwhelmed, time to get that person some help. You want to provide education and training to the caregiver. And that can be done for families too. There are great family education programs. The Alzheimer's Association offers caregiver education specifically about dementia. There are community groups, hospital support groups, online support groups. So education and training to the caregiver helps to prevent abuse and can help ease the situation and improve the situation to stop abuse. Providing services to the caregiver, right? Treat the problems that are causing the abuse: mental health treatment, substance abuse treatment, counseling. Frequent visits. No one should be isolated, just the pair of the elder and the caregiver. Family counseling, involving the elder if possible. Financial assistance, right? Take off that financial burden. And sometimes a guardian has to be appointed through the courts in order to protect the elder from financial abuse and physical abuse or neglect.